Hey everybody. Okay, we're gonna have a discussion for anybody out there with a spinal cord injury. Um, Anybody that's interested. Um, for me, I figure if I'm gonna make these videos, I may as well just talk about the most uncomfortable things first. Once I get that out of the way, the rest ain't shit. So we've got first we got bladder and bowel care after a spinal cord injury. It's pretty complicated. And it's regarding bladder. Okay, so when you're first paralyzed or have a spinal cord injury, most levels of spinal cord injury, you lose all or partial control of your bladder and bowels, incontinence. Um, so with your bladder, upon the first injury, they have you straight cath every 4 hours. Um, Insert a catheter, drain it, take out on your day again. Monitor your intake, you monitor your outtake, etc. That opens up for infections because every time you do it, you're introducing a foreign device into your body, which makes you immediately prone to infection. So the self care in that part, if if that's where you're at in that, is very important to try to eliminate all the infections you can. We'll discuss that later. But for a cat, you gotta. It's important that you maintain the routine. You have to keep your body trained to do what it's supposed to do without your control, to the most of your ability. So, like with your bladder, as long as you're draining it, it's able to hold. Up to however much before you have to drain it again. If you ignore it, like me, I was an addict and didn't care. We'll cover the 5 stages of grieving. I was stuck where I was at, and I didn't care. So when you do that, you just go, and you don't cath. So then your bladder loses the ability to retain fluids. So then you're just constantly going. Then you got, we'll cover pressure later. You got pressure ulcers, you keep moisture, all that opens up whole new avenues. So once you lose the ability to retain fluid in your bladder, you get either an indwelling cath or a suprapubic cath. Indwelling cath, where a catheter goes inserted in the penis, vagina, um, goes and drains all the time into a bag. A suprapubic catheter, because when you have one through your urethra, um, it opens up a lot of infection risks just through, like with the male, just through the urethra, the extra length of the penis. Um, Makes it all the much more area to be prone to infection. The suprapubic catheter goes in below the belly button and above the pubic area, and they insert a small hole soma, insert a catheter into the stomach, and it drains from there all the time into a catheter bag, which basically works like a funnel. Yeah, like you got to keep your bag lower than you, and it just siphons out whatever, like a gas tank. Um, so that's what I have for care of that, and then cover, since we're on bladder infections, we cover that. But okay, so with the infections, it's very important to only treat if you're symptomatic. If you're not symptomatic, because you always will have these infections, just because your urine smells or you just assume that you have an infection with no symptoms, you don't want to tell your doctor and get treated with antibiotics, because all them bugs are going to do is swim around that shit and turn superbugs, literally. Then you get into infections like MRSA, Pseudomonas, collination, and IV antibiotics, vancomycin. You go a rough line there. So the infections, you got to maintain cleanliness, stay sanitary. Bacterial body washes are good for the shower. Eliminates a lot of the germs on your skin. Um, and then, okay, bowels. Bowels, you have to have a program too. You have to keep your body trained to go at certain times, just like you would in a normal. You have a routine. You keep your body in that, and your brain and your body still understands to an extent what to do. So I still have that one in my ability. So the bowel program is very important. Constipation becomes a very big issue, especially if you have use of opiate for pain care. It just causes a lot of complications. You get what's called a paralytic bowel, is where you have muscles in your bowel that contracts, and that moves paresthesia. It moves everything along the way it's supposed to move. So when spinal cord injury happens, all that just becomes really a less movement. So you have to. That's where you have to, like, I drink 5 bottles of water a day, plus my juice. I cut soda out, um, just to stay hydrated and keep everything going. Um, Laxative dependence becomes very big. You end up like, I think I discussed all the Metamucil, the Miralax, the Senna, the Amitiza, the Ducalax suppositories, the enemas, you name it, obstructions, um, impactions. It's crazy, but it's just part of what has to go on after an injury. And to this day, I still, when I have an accident, apologize, and that's not necessary. Everybody has to, it's just how shit works. No pun intended. So you have to care about love yourself, and understand and say, okay, we'll cover the stages of grieving, but denial and not accepting the reality of what things are and doing what you can with it is, that's all you got. And once you realize that the adaptability that you really have inside, and the amounts of things that you can overcome, um, is bewildering. You can go from being an addict on your face on the floor and try to get up and do something. So that's all right now. Love yourself. Take care. Peace out. Trips out.